Hey guys, welcome back to my channel Made Simply Easy. In this video, we're going to see about the Cushing's triad. It is caused by increased intracranial pressure. First, let's see what are the three features under the Cushing's triad. The first is decreased heart rate, increased blood pressure, and widened pulse pressure, and irregular respiration. Now let's see how all of this is interrelated. Now, head injury, tumor, stroke, bleeding, either due to hematoma or hemorrhage, causes increased intracranial pressure. So all of these reasons are due to volume loss or blood loss. So normally the mean arterial pressure is more than the intracranial pressure, so that the brain receives enough blood and enough oxygen. But in this condition, due to the increased intracranial pressure, Cushing's reflex is activated. Now, as the intracranial pressure increases further and becomes more than the mean arterial pressure, that means that the brain is not receiving enough oxygen. That means the brain is under ischemia. So this lack of oxygen and lack of blood activates the sympathetic nervous system. So this sympathetic nervous system activation causes increased systolic blood pressure and increased blood pressure on the whole, hence hypertension. Now this blood and there is decreased diastolic blood pressure as well. So this causes widened pulse pressure and decreased pulse rate. So now when blood pressure is increased, it activates the parasympathetic nervous system, and which causes the decreased heart rate and irregular respiration. Now in the respiration, there is decreased respiratory rate and Cheyne-Stokes respiration is seen, which means slow deep breaths followed by periods of apnea is seen. Now I'll tell you a simple way to remember all of this. So there's hypertension and there's decreased heart rate, and there's a decreased respiratory rate and there's decreased pulse rate. Heart rate, respiratory rate and pulse rate is decreased, whereas blood pressure is increased. Now let's see what are the other symptoms of increased intracranial pressure. Weakness, lethargy, headache, vomiting, blurred vision and changes in behavior can also be seen. Now how do you diagnose Cushing's triad? First is by lumbar puncture to make the CSF analysis. The other two are imaging modalities. First is CT brain and MRI brain. Now let's look at the treatment for Cushing's triad. The first is IV mannitol, which is an osmotic diuretic. The second is furosemide, which is also a diuretic. Now, mainly, by the way, IV mannitol helps in decreasing intracranial pressure and also helps in increasing the cerebral perfusion pressure. And then we can also give methylprednisolone, which is a steroid. Hyperventilation and head elevation is also advised. Craniotomy can also be done to relieve the increased intracranial pressure, but it is usually rare. Now if this condition, if left untreated, causes uncal herniation. Now to summarize, in Cushing's triad, decreased heart rate or bradycardia, hypertension and widened pulse pressure, and finally irregular respiration is seen. Thank you. For more such triad videos, watch the next video in the above playlist.